That's a lovely painting behind you, Mr. Dunn.
It
Thank you.
is.
Where is that from?
The Coronado Island over in California.
Okay.
Yeah.
That's a great place to go.
Yeah, it
It
is.
is. It's an expensive place to go.
True.
And the beach is beautiful and gorgeous, but it's too cold for me.
It is. The water's always cold over there.
Yeah.
Yeah. Yeah, I was told by learning to dive in Bermuda and living in Bermuda. So when I try, before my injury, when I would go diving in California, it's cold and dark, and I'm, I'll continue to dive in Bermuda.
Right. I mean, I grew up in the tropics, and so the waters are always balmy, and
Right.
yes.
Yeah.
One thing I miss about Philippines, like there's 7,107 islands during high tide and 7,108 during low tide. One island pops up.
That's crazy.
Where's that at?
The Philippines.
Philippines.
Yeah.
Yeah.
Yeah, I think the Philippines is the second biggest archipelago. Indonesia is bigger, with, I think, more than 13,000 islands. Good morning, everybody. If you're just joining us, thank you again for spending your morning with us. We're going to wait maybe one more minute so others can join us as well. And then we're going to start at 8 to 1 in the morning.
Welcome to this morning's geography lesson.
Yeah, I used to cover national security when I was a reporter in the Philippines, and we call it the three countries: Malaysia, Indonesia, and the Philippines. The borders are really porous because they're and these three countries have a really long history in relationships and what have you. But those two places, you can just go hop on a boat and go to Borneo or Malaysia or Indonesia, and yeah.
Nice.
All right, I think we're going to start. Good morning, everybody. Thank you for joining us this morning. My name is Luigi Del Puerto. I'm the publisher and editor of the Arizona Capital Times. Welcome to today's morning scoop. As you know, the elderly in Arizona, but elsewhere in the country as well, are bearing the brunt of the COVID-19 pandemic, which has been devastating to residents of nursing homes and similar facilities. Consider this, for example, 144 nursing home residents died in a recent 4-week period. The total number of deaths in Arizona is almost 16,000, and of that number, 75%, close to 12,000 are our senior citizens, those who are 65 and above. We have a big subject and a couple questions that we want to go through this morning. But first, I want to thank our sponsor. AARP, of course, is the nation's largest nonprofit and nonpartisan organization dedicated to empowering people who are 50 and older to choose how they live as they age. AARP has 38 million members, and it seeks to strengthen communities and advocates for what matters most to families, health, security, financial stability, and personal fulfillment. AARP's chapter in Arizona, the AARP Arizona chapter, is the leading voice at the state capitol, advocating for the well-being of residents over 50. Among other things, the group has helped to formulate some of the biggest health policy decisions, but also other decisions in our state. Recently, the group's work led to the creation of Arizona's Task Force on Long-Term Care. And of course, the work is far from over. So I want to thank again AARP Arizona for sponsoring today's morning scoop. We have a great panel this morning. Joining us is Dana Marie Kennedy, who is the state director of AARP Arizona. As noted earlier, the AARP advocates for the population that is most at risk of complication from COVID-19. The gravity of that fact weighs heavily on Dana as state director, and she has hunkered down to work. Her advocacy efforts undoubtedly has shaped and is still shaping the state and country's response to the pandemic. In particular, Dana's testimony before Congress brought to sharp focus the plight of the elderly in senior nursing homes. Her advocacy work, of course, transcends the current pandemic. As founder of Emerge, she has trained and encouraged thousands of women to run for public office. She has served as the state coordinator at the Arizona Association of Area Agency on Aging on the House Ad Hoc Committee on Abuse and Neglect of Vulnerable Adults. Dana, thank you for joining us this morning.
Thank you so much for having me, Luigi.
Also joining us is Representative Jennifer Longdon, who represents Legislative District 24. I got that one correct, right?
Yep.
Representative Longdon. Perfect. Awesome. This is a position that she was elected to in November of 2018. She is a fighter. In 2004, she was paralyzed in a random drive-by shooting, changing the trajectory of her life. Before the shooting, she was a successful businesswoman and provided her family. And after the shooting, she struggled to stay afloat, losing her health insurance while lying in a hospital bed in a coma and confronting poverty head-on. But as I noted, she is a fighter and she triumphed. Upon her recovery, she began working to raise awareness and improve the lives of people with disabilities. She also devotes significant time to gun violence prevention, spearheading grassroots efforts and advancing policy change at the local, state, and national level. Additionally, she is invested in efforts to increase opportunities and access for marginalized groups in the state. Representative, thank you for joining us.
Thank you. I'm looking forward to a great discussion this morning.
And finally, joining us is Representative Tim Dunn, who represents Legislative District 13. I was organizing a prep call last week when Representative Dunn's assistant, short anecdote, told me that he might not be able to get back to me right away on Friday. And the reason why is he's working on the farm. He is a lifelong resident of Yuma, and he operates a family-run business called Dunn Grain Company, which specializes in selling grains and sporting crops like garbanzo beans, black-eyed peas, Sudan grass, and wheat. He was named the 2017 Arizona Farm Bureau Farmer of the Year. He has been an active voice on county issues related to agriculture. And in 1999, the Yuma County Chamber of Commerce awarded him the Agricultural Person of the Year. He was also appointed by the governor to the Arizona Department of Agriculture's advisory board from 2006 and 2011 and served as chairman in 2009. In addition to his service on this board, he served in various state and national committees from 1995 to 2015. He is a graduate of the University of Arizona with a BS in agronomy. And Representative Dunn and Representative Longdon have been working together on long-term care and improving the plight of Arizona's elderly population. Representative Dunn, thank you for joining us. How's the farm, sir?
Everything's doing good. Thank you for asking me to be here. Thanks.
To our viewers and to our listeners, thank you again for joining us. We do want you to ask questions. Send your questions via the Q&A box and the chat box, and we'll try to get to as many of them as we can toward the end of the program. So don't hesitate to engage that way. As I mentioned, we have a big subject this morning. I want to ask Dana. Dana, give us the lay of the land. We had a pandemic. We went into a lockdown in March of last year. Where are we in terms of the health of our seniors, our ability to actually protect them?
So this has been the population that has been hardest hit by this pandemic. And I stood with the governor when he decided to do an executive order and close down our long-term care facilities to visitors. We saw what happened in Washington State. And when COVID gets into a facility with congregate setting, it's absolutely devastating. And so we closed down our long-term care facilities on March 10th, and then families were restricted to visit their loved ones. Early on in the pandemic, we didn't know enough about this. I raised concerns regarding how the direct care workforce works often more than one job. They often make minimum wage. They do not have sick leave, and they often don't have health insurance. And so after months of families being restricted and families calling me, pleading for help to find out what was happening to their long-term care residents, their parents, their spouses, I pleaded with the governor to form a long-term care task force. And so that long-term care task force was started in July, and we came out with recommendations. We worked quickly. And within 3 weeks, we came out with recommendations to be able to allow each resident of a long-term care facility to have 2 people represent them called essential visitors. And they agreed to be tested as frequently as they were testing the staff. And we got to a point where testing was more readily available. In the beginning, we didn't have enough tests. These facilities didn't have enough PPE. And, we also didn't allow transparency. So we were not sharing with the public where we had outbreaks. there were people who worked inside these facilities that weren't even told that there was COVID in the facility. We had management tell people to come to work even though they had signs of symptoms of COVID. So far, what we know is almost 2,500 people in skilled nursing facilities have passed away of COVID. That doesn't even mention how many people have died in assisted living facilities and assisted living facility group homes. We don't have that information. We're one of the only states in the entire country that doesn't disclose that information. So we don't have a real picture of how devastated this virus has been to people living in congregate settings. The situation has certainly gotten better, and the governor made testing or vaccinating this population his top priority. So to this date, all 147 facilities have had at least one, if not two, doses of the vaccine. And our assisted living facilities, at least 50% of those residents, as well as staff, have had the opportunity to get vaccinated. There has been a rapid decline regarding outbreaks in the facility as well as staff. And I think we all know now today, if you're 55 and older, you can get a vaccine. We started at 75 and older, then dropped to 65 and older, and today we're now at 55 and older. So we're definitely making progress, but it's far from being where I would like it to be. So thank you so much for allowing me to make the opening remarks.
Thank you for that, Dana. I can tell you, for example, that in my situation, my mom lives with us. She's 80 years old. And our biggest concern, of course, was to make sure that she is safe. And so we really hunkered down. We didn't really venture out. My wife is a hospital nurse as well. And so there's a potential of her getting COVID-19 at the hospital and bringing it home. And, and then my mom is really at risk. So when the vaccinations were made available to her age group, immediately I found out that obviously my mom doesn't really know how to use a computer. And so I have to do all that appointments for her, for example. But also I found out that the elderly population in our church, for example, has exactly the same issue. They didn't have computers, they didn't have Wi-Fi, didn't have internet. Thankfully, some of them have smartphones. So we were able to get them, I was able to help them get their appointments that way. But I want to ask Representative Dunn, what are you seeing anecdotally, sir, from your districts, from your constituents, for example, among the elderly in terms of getting the elderly population vaccinated? Just anecdotally, is everybody for example, at that age group already vaccinated at this point?
Just that age group in general, especially here, Yuma is a big part of the district. It's very hard to get the vaccines because of the small amount that's coming to the Yuma County. And we have a winter visitor population that has an additional 50,000. Usually it's around 125,000 winter visitors here. There's probably, guess, between 60 and 70,000 right now. Those are not accounted in the CDC in their census program. So we're seeing that we have everybody that same population is everybody's trying to get online, trying to get those vaccines. So it's very complicated for Yuma and retirement areas of Arizona all over, because they're not included and they're over 65 or 75, depending on what benchmarks you're at. So that age group we're really way behind the curveball, especially in Yuma County for getting that age group. That's separate than the homes. The homes are a different allocation of vaccines.
Thank you for that. And Representative Longden, I want to ask you, ma'am, the perception, and correct me if I'm wrong here, the perception is that the legislature did not really focus on COVID-19 relief immediately as they should. Early on, we saw them, for example, focus on voting issues. And obviously, we're still in the middle of session, so that's not to say you're not going to pass COVID-19 relief, but there was that perception. Can you correct me if that's a wrong perception of where things are at in the state legislature?
Well, I don't think that we've seen a lot of bills that have been directly to address COVID. And I certainly, I would like to see us do more work in that specific direction. Through the summer, during interim into the fall, my caucus met in small groups to work on issues that we felt were directly impacted by COVID, you know, how small businesses are being impacted, how nursing homes are being impacted, education, and drafted some legislation that, you know, I'm hoping that we'll still, you know, nothing's over until sine die. So I'm hoping we'll see some additional work done. Now, some of the work that Representative Dunn and I have been working on in terms of long-term care reform, and Dana Kennedy and others were part of our ad hoc committee to do that work. There are big pieces of that would be helpful in this particular moment, and they are making their way through the system.
I want to go to Dana and I ask you the same question, ma'am.
Oh, I think this legislature has definitely misplaced their priorities. I think that we have seen how hard hit this population is, and I would think that it would be one of their #1 issues to address. What do we need to do to protect this population from this never happen again? You know, I keep hearing about election reform, and, you know, I think that we have one of the best systems for allowing people to vote. And I even worked with, you know, with the Secretary of State, as well as the county recorders, to make sure that people in long-term care facilities were able to vote. This was one of the very first time in our voting history that we really had a huge focus on making sure those people in long-term care facilities were able to vote. Keep in mind, they usually get help from family members, and family members were locked in and residents were locked, or they were locked out and residents were locked in. And so I would like to see them make more of a priority regarding, look at our home and community-based services. What do we need to do to keep people at home and out of facilities? What do we need to do to protect our facilities? I would say Representative Dunn, as well as Longden, have some bills that go a long way, you know, to help address the issues. But they didn't come from COVID. They actually came from what happened with the hacienda. And so Representative Dunn has a bill that would increase inspectors, funding for inspectors. Some of these inspectors, you know, only go out once a year. Now, we just recently had a case, a resident of a group home who was murdered by the caregiver. And, you know, the owner of the facility owned 2 homes, and one of the homes hasn't even had an inspector out in over a year in COVID. So, you know, where is that outrage, and who's saying, well, let's do more? I mean, these 2 legislators with us today have done more than most, and I commend them for their work. We also need to make sure that, you know, a bill to increase funding for our area agencies on aging, that gets through, and that we fund services to go into the homes to keep people where they want to be and out of these congregate settings. There's also a bill regarding the definition of abuse to add another level of what the definition of abuse is. And so, you know, I would like to make sure that the legislature focuses on our vulnerable adults more and less on electoral reform. We don't really have a problem with our elections. You know, I think there's been a lot of hysteria to suggest that we have a problem, but, you know, I would like to actually make sure that we are investigating how we have so many deaths in our long-term care facilities. Many of these facilities had infection control in the very beginning before COVID. I think over 70% had some type of citation regarding infection control. And then you add COVID to it. And, you know, so what are we doing to make sure that we're appropriately making sure that there is enough funding for ombudsmen as well as inspectors? The ombudsmen were also locked out of these facilities. So, you know, some facilities still haven't even allowed visitors almost a year. So what are we going to find when family members actually are able to go back into these facilities? How much abuse and neglect has happened in this past year? You know, continuing to hear from family members that their loved one isn't eating, their social isolation, the depression. You know, we need to do better, and I think that we should.
Thank you for that, Dana. Representative Dunn, sir, you've been working on this issue for a number of months now. What has been, I think as Dana pointed out, some of these problems have been magnified by COVID-19, but they've been in existence for quite some time. What has been some of those problems, and what has been some of the steps that you think we have taken as a state to offer solutions to those issues?
Well, Ms. Kennedy made some good points, and I think that if you go back to the committee that Ms. Longden and I did, and Ms. Kennedy served on, I learned so much through that process, and I think all the stakeholders that were at the table through that process learned where there is some holes in crossover and the different agencies, how they interact with our group homes and all the different facilities that we take care of. And so I learned a lot about that, and the 10 points that we came up with. Some of those bills that dropped last year, if we didn't have weren't stopped with COVID, we could hopefully had some of those things done ahead of time. But we're back at the table now trying to put those bills through. But we already had a problem with these facilities before, and COVID just exacerbating it. So, trying to get these inspectors, the governor's recognized that was requested in his budget as well. Trying to get those people to come in. A really important one that we're working on is a pilot program, so that we can come in and do some, basically I call them like well checks, like a watchdog group to come through. Super important. We're still working on that. That bill ran out of time last week before we got to get it to the appropriations, but we're working on it in the Senate. Still bringing that to the table. Those are some super important things to try to get in and figure these issues out, not as a gotcha, but as a making sure facilities can do better. And then if someone is a bad apple and not doing something correct, then we're going to hold them accountable. But right now we are afraid what we're going to do is opening up those doors and see what happens when people come in. So all of Ms. Kennedy's points are exactly right. I think the governor recognizing the early on that in having that task force, trying to get in, it's just one of those. It's hard to manage when you're live in a pandemic. Trying to, what is the best thing to do? Where do you send people? What do you do? How do you let people in too soon, too fast? So obviously, I think you need to have, family members being able to talk to their loved ones. That socialization is hugely important. Luckily, there's some technology, but yeah, it's sometimes you can be too safe, and that's worse than the disease. But when you're in those congregate settings, you got to be very careful. And so, but I think where is some big problems that were outlined about letting people coming in, having them come to work with their not being sick. We weren't doing that in our businesses. So any of these other businesses, you shouldn't be doing it either. So you need to hold the people accountable and let them do their job, but hold them accountable. And I think some of these bills we're working forward is going to do that. And we're going to hopefully get them to cross the finish line because we knew that 2 years ago that we needed this, and we definitely need it now.
Representative Longden, ma'am, I want to talk to you about the idea of inspectors. Can you flesh that out for some of our audience who may not be as familiar as to what you're trying to accomplish here?
With the inspectors?
Yes,
so,
ma'am.
We learned through our ad hoc committee that there isn't a specific watchdog. There are agencies who are tasked with pieces of monitoring. But when you sign your loved one in as a resident in a long-term care facility, I think we assume that there is a watchdog looking at these situations. Now, one of the things we learned ahead of the start of our task force, for example, was that the Department of Health Services needed an additional 44 inspectors in order to deal with all of the priority B claims inside of long-term care facilities. Now, priority B claims simply meant that they were not an immediate threat to life and limb. So there are instances where some of the reports were another resident choked me, or I was hit by a caregiver. People found to be left in soiled linens for extended periods of time. So these are all still very serious, but they were not being investigated. We learned that through the work that we did, and I think we asked some tough questions as a group, because all of us in one way or another have skin in the game. This isn't a philosophical problem for us to solve. So the other thing that we learned is there's not a watchdog, an overall watchdog on all of these facilities. Someone who can today kind of drive by and say, I'm going to go inside that one today. And, when you walk in, if you're hit by the smell of dirty sheets and open wounds, you have a problem. If you're walking through a facility and residents have pressure sores, or seem to have poor relationships with the caregivers, then those are issues to be looked at. And we didn't have an agency specifically designed to do that. I think we found that all of the agencies, at their core care about these issues, but they're heavily siloed and those boundaries aren't very porous. So as a family member, if you find that, your issue starts by working with access, but then you need to talk to DHS, or then you need to talk to another agency, you have to start all over again. There's not like this handshake handoff between these agencies as an individual works their way through the system. And the system has turned into, a very daunting mechanism to try and work your way through if you're a family member or a resident. And so it was really important for us to try and help solve some of those issues. So some of the bills that came out of our ad hoc committee, and Mr. Dunn is running all of the big appropriation bills that came out of our committee, was funding these inspectors that DHS has asked for. I think
how much are we asking for, ma'am? Sorry if I may interrupt. How much are we asking for in terms of the funding for inspectors?
3.3 million for 44 inspectors for DHS. That's a one-time appropriation. We need to clean up that backlog. On the pilot program, which would be watchdog, if you will, for these DD group homes, which would be a good way for us to get started on figuring out how to work out this monitoring system, was 1.3 million for 16, Mr. Dunn, 16 FTs, I believe. And then we asked for, I think, $300,000 to do an audit of adult protective services and help learn where some of our pinch points are there. And I think those were our big asks that came out of the task force.
Before I go to Dana, Representative Dunn, what are the chances of these asks making it to the governor's desk?
Well, it's going to be a negotiation in the budget, and you know how that works. But the good thing is the governor's ad hoc committee that he had, and it's that 3.3 million is in his proposed budget. So we're off. That's a good start. That doesn't mean it's a done deal, but between that and we're going to work on in the Senate on the Senate appropriations, and we're going to bring up the one that ran out of time last week in the House for the pilot program. We're going to bring that up in the Senate hearing to try to combine those together. I got to just meet with the appropriations chair. But yeah, that's kind of our plan going forward, is take those three bills, put them into one ask, saying this is what we need. It's a start to help with our long-term care community of trying to just do an audit and try to get those inspectors. And so, and because it's, you look at it, we have one of our businesses, we have an audit that comes through quarterly at our Sport Club's haircuts. And so they come through, and it's through the franchise, and they come by, and one quarter's it's unannounced and one quarter it's announced. And so you have to hit a certain benchmark on those as a franchise to make sure that they're doing all the things that we want to do as a franchise. And so we get a scorecard, and that's what I kind of look at this watchdog group. You go through and get this scorecard and see how things are doing, where they need to improve at. And if there's a health risk, you're going to actually flag that and come in and do some, take the precautions that need to be done. But if it's more just like, you're getting an 80%, we really want you to have a 90% on this scorecard, then you can know where to do better at. And it makes the health and the services that much better. So if people know that they're trying to have a benchmark and a scorecard that they're looking at, that's kind of how I look at it. That's why I brought it to the committee. That's how we've been kind of talking about it going forward. It's it will be a watchdog. It will be a gotcha go moment, but the plan is more of a teaching moment, and say, how do we do a better job at providing the services? Here's our scorecard that we need to be doing, and someone's going to come back in and check on us because things aren't perfect. People have problems, and employees have a bad day, but they should not be doing abuse and neglect. Where they take too long this time to change something. It might have been because they were helping somebody else. So but you got to go through those complaints, and if it's an ongoing complaint, then that's when they do those audits, they'll be able to figure that out. It's either this employee or the management is not doing something that is current in the services that we want to provide.
And of course, just because a bill that has a money attached to it is not heard in committee doesn't mean it's dead. It's all part of the budget process. At one point, both chambers and the governor are going to sit down and say, okay, this is what's feasible for this year. And so a bill may technically die, but the idea is alive then in what's called a burb.
Correct. And that's part of the negotiation of what we need. And as we move forward, as both caucuses move forward, and that's what we have these bills that come through appropriations, because those aren't going to individually be signed unless it changes statute. You will not; those bills won't be actually ever be signed by the governor. They're just part of the budget process, unless you're changing some kind of law that goes forward that needs a statute change. But yeah, so it's through the process, and you go on the Senate side, let those members understand it and talk about it. And so then when you're asked in your groups, this is what's important for our caucus, and this is not a partisan issue. This is something that we're doing to try to bring it out to this is what we want to do. Sometimes there's a difference of opinion on whether we're growing government, not growing government. And like I made comments in our appropriation hearing, we are already tasked and we're already taken care of as access and as a state. It's our responsibility. We're doing these things. So we need to do a better job at what we're doing. And so it's our responsibility to make sure we're funding that correctly and make sure my colleagues and on both sides of the aisle understand that we need to do a good job at what we're doing. And currently we're not hitting the mark.
Thank you, Representative Dunn. And I'm sorry, go ahead, ma'am.
Oh, I'm with Mr. Dunn on all of this. And I think that we're having good discussions around this issue with, folks in terms of appropriations. But, we're not asking for a lot of money here at this point in time. We're asking for assistance in ensuring the health, the well-being, and the safety of our loved ones, of your loved ones. We have almost $1 billion in the rainy day fund right now, 970 odd and change, because some was used for COVID relief, a small amount. The governor has proposed $200 million in tax cuts for this year alone. And in the 3-year budget, that's $1.2 billion by the time that's done. And certainly we can find nearly $5 million in the budget to help ensure the wellness and safety of our family members, of your mom and dad, your brother and sister, your grandparents, your aunt and uncle. These lives matter. And the fact that they are behind walls and difficult to hear at this point in time, they've been cut off from communication because of COVID, makes it even more important that we get inside and find out what's going on right now.
Thank you for that. And just a reminder again to our viewers and our listeners, don't hesitate to send in your questions via the Q&A box and in the chat box, and we'll try to get to as many of them as we can toward the end of the program. Dana, these are systemic problems that we've talked about. As everybody's noted, these problems have been magnified by COVID-19, but they've been in existence before then, and we've been kind of nibbling at this problem, and now we really have to solve them because they're staring us in the face. One of the problems you mentioned is the problem of wages. We're dealing with a working population that may be low wage, don't necessarily have benefits. And if that's the case, it's difficult, first of all, to get good workers. It's difficult to keep the workers, but also you create a kind of an environment where abuse could happen. I'm not necessarily saying that it will arise from, having a low paying job, but that is plausible.
So if you do not value the people who are actually providing the direct care work to our elderly, then you do basically saying that you do not value the elderly. And this should not be a minimum wage workforce. And this should be a job that people want to do and love doing. And the majority of the workers who do this job, they love what they do and they love those residents. There are always a few bad apples. And I also, want to point out that there's a civil liability bill that's going through right now that would basically allow these long-term care facilities to have immunity from lawsuits. And we already made it really hard for people to be able to be convicted of a crime. And now we're just going to basically make it even harder to be able to prove. Now, what happened in Hacienda was a few years ago, the evidence was a baby. And she was full-term pregnancy and nobody even realized that she was. And we just had the case just last week that the press, revealed regarding an owner who actually killed one of the residents. And I don't know why it took so long for that information to become public. The wife called in October. There was an investigation, an autopsy done that came forward in November. And then the person was just charged in February. How could that happen? And so we need to make sure that we actually look at who is protecting them. We mentioned Adult Protective Services. They don't go out immediately. Inspectors, they just license the facilities and make sure that they're running everything appropriately. And if you suspect something bad is happening to a loved one, you know who you call? 911. 911. And they go out and decide if there is criminal charges there. And so, Child Protective Services, they have to go out immediately. So why is it that we don't make Adult Protective Services, be more of an enforcement agency? So I think that we did a lot of work, but a lot needs to still be done to actually identify what is it, who is the oversight agency? They're all pointing fingers at each other as far as who's in charge, and it doesn't work. And we need to actually figure this out. And so, we're not done and our work's not done. And I think that, COVID is going to even exacerbate all of this. We already know it. And I think our work is definitely moving forward. This year is not going to be, the end all be all of this. I think we have to have a multi-year approach to this. And funding is just part of it. Actually being able to make sure that we have the oversight in these facilities, that they run properly. And, the case for the group home with the man who was murdered, they were fined $1,000 because they didn't report that within 24 hours. They still have their license.
I think the APS audit, the Adult Protective Service audit, is that's what we figured, that it's more than just, we're going to audit. Like we always see, just an audit and just put in a file somewhere. But our intent here was that when Child Protective Services, we revamped a few years back, kind of did an overhaul, really looked at what they were doing, and they fixed their system, their reporting system, the computer system. When we went and toured that facility, we learned a lot about what they had done. And this, in my mind, this audit is something to figure out just what you were talking about. Where do we need to do? How do we need to fix these issues we're talking about? It's not just, we did an audit, your bills are fine, you're doing these things, you need more money. Everybody always says more money. This more is an audit on process about what we're going to do and how do we fix some of these issues like they did with Child Protective Services. Even though CPS is not perfect, but it's a lot better than it was 5-7 years ago. So that's kind of in my perception of the reason for that audit. So it gets to some of those underlying issues and tries to figure out how to fix them and not just put a report in a file somewhere.
And we also need to make sure that we're doing the appropriate training for this workforce. And they want to go to work and do a great job, and we need to make sure that they're trained well, and also in identifying abuse and neglect and then reporting it if they notice it.
And that was one of the other bills that, I'm sorry, Luigi.
Go ahead, ma'am. No, go ahead. Jump in. No, go ahead. Jump in, please.
So one of the other recommendations, one of the other bills we worked on was to ensure that inside of long-term care facilities, that the residents, the staffers, and family members, visitors, had the opportunity to understand what abuse and neglect looks like, grooming, all of these sorts of behaviors that could become part of abuse or neglect, to understand what they look like, what to do if you spot the signs, and where to go for help. Because again, this is such a labyrinth. We want that training done annually, because when I become a resident of a facility in year one, I may be this may not be my issue, but as my time inside this facility goes on, year 5, year 10, things can change. My condition might deteriorate. The people around me caring for me might change. And I do want to point out, as Dana said earlier, so for those of those that don't know me, I'm paralyzed. I use a wheelchair full time, and I've relied on private caregivers in my own life. Caregivers become a part of the family. They're more than a friend. They're more than a sibling or a child. These are folks who help you with intimate care. They get to know you better than anyone else. And I agree that in most cases, our caregivers love us. They're willing to sacrifice their own health, their own well-being, their own safety on our behalf. What we're talking about in most terms are those few bad apples, but those few bad apples create incredible, murder a person, impregnate a woman in a low consciousness state, lead to bed sores, pressure sores that can then lead to death in our family members. So we need to be very vigilant for those folks who, due to their health conditions, their disability, cannot advocate for themselves.
Representative, go ahead, sir.
I think we need to highlight that again, because there are some comments in the chat that majority, I'm not sure what the percentage, I would guess over 90%, we have great people. We can't have these facilities without the workers and the care providers that are in there, and we need to give them hats off. And we do need to go back to the salary portion, because when the minimum wage went up, you have compression for all those, the ones that were making higher than average wage. So now you've got that wage compression, and we do need to focus on that, getting that access reimbursement rate higher, so that we can have better, so we can make sure we have people wanting to come into that facility, because they are doing a good job.
So when you're talking about the wage compression, what you're really talking, correct me if I'm wrong here, when the wage went up, then suddenly you have workers in this industry, let's say in the DD industry, in the behavioral health industry, all these industries, right? They're having to compete now with higher wages, that are being offered, let's say at the restaurant industry, for example. And so that's creating the compression that you're talking about. Yes,
sir. So you were getting $4 or $5 higher than the minimum wage. The minimum wage gets moved up, and with the reimbursement rates and the ability for business to pay, those people are getting the $3 or $4 premium are now getting $1 premium, or they were getting, instead of getting $15 an hour, now they're only $3 higher than the minimum wage. And so, like you said, a lot of people aren't even paying minimum wage. So yeah, they can't afford to pay higher because the reimbursement rates aren't there. So it's compressed everybody into getting paid the same, even though you should be paid higher because of the skill required or the job you're doing.
Right, and it's a difficult job, and so now you have a problem with recruitment and retention. I want to ask you, what are you hearing from the nursing homes, sir, as you're going through this process? What have you heard from the management of nursing homes and assisted living facilities?
Were you talking to me first?
Yes, sir.
Yeah. First, basically, it's been a moving target as we go through this process. We're trying to get testing, trying to make sure we have, we're short on testing, like everything. And I agreed with the governor, trying to focus on getting that first, and then they want to get in the vaccines. They were early on. It's just they were afraid to allow people to come in. They were afraid that an outside person, we didn't know how the disease was going to spread. So they were in an abundance of caution. They did these management decisions, and it's always easy on Monday morning quarterbacking to figure out what we should have done differently. But I think if we'd had testing more readily available, we could have got people tested into their homes easier. But they were just afraid to open up their facilities, and afraid for that just having a wide run rampant loss. And so now the vaccines are going through. I think we've heard that, like you said, they reported that over 100% of I think I got the data here, 100% of the skilled nursing facilities have been done. 90% of the second doses, assisted living are 75% on their first doses. And 7%, this is as of last week. So they're very thankful now they're able to get that target. And so it's just a concern of that balance as a business owner and a manager of just as far as COVID related, and so I think we do know, and they do know that they need to have their loved ones in. It's just how they balance that.
And Dana, I guess I'm going to ask you the same question, ma'am. What are you hearing from the nursing homes? When you reach out to them, or maybe they're reaching out to you.
So I hear from them on the long-term care task force that the governor appointed. So the majority of people on that task force are the industry itself. I feel like I'm the lone advocate on the committee, but there are elected officials on the committee as well. So Representative Osborne is on the committee. Kate Brophy McGee, she still is on the committee, even though she's no longer elected to office. And Payne is also on. And then, yes, Representative Longden is on the committee as well. And so we hear from the industry. So they say that they want to let residents in, and they have approved the guidance that we put forward. If people want to read that guidance, they just need to go to the Arizona Department of Health Services website, and just there's a search bar there, and just Google long-term care visitation, and the guidance will come up. And we're in the process of updating the guidance right now that people have gotten vaccinated. So the facilities say that they want family members in. They know that family members often help provide the care to the residents and to their loved ones. And so they say that on the committee, and hopefully they say that to the family members. And remember, the family members are agreeing to be tested as frequently as the staff. So I have a husband that his wife has early dementia, and he sees her at least 2 to 3 times a week, and he is tested twice a week. He would like to see the guidance updated because he has been vaccinated and everybody in the facility has been vaccinated. And so hopefully we can make it a little bit easier for them to continue to visit their loved ones. The other thing that I think is important to note is we want to set this workforce up for success. And part of that is making sure the staffing ratios are appropriate. If you have double the caseload of what you should have of caring for residents, you're setting those workers up for failure. They cannot possibly meet the demands of this very frail population that needs sometimes assistance with almost all activities of daily living. And so we need to make sure that we're looking at the ratios. And as far as I think the other thing that is important to note is what family members have learned through all this is there's a big difference between a skilled nursing facility and oversight there and assisted living facilities and these small group homes, which are simply licensed. And so they don't have the same oversight that the skilled nursing facilities has. And that's part of because of funding, and they have to adhere to federal guidelines where the assisted living facilities and small group homes do not. And if people want to do research as far as if there's any citations, they can also go to the Arizona Department of Health website, and there's a long-term care check. So they can actually Google if they have any violations, what the violations were and when they were. So that's important to note for family members as well.
Resident London, ma'am, I want to ask you, what I'm hearing is that, we have some systemic issues, but primarily it's also a funding issue. It's a big funding issue. You solve wages with reimbursement rates, for example. You hire more inspectors if you have the money to actually hire more inspectors, and so on and so forth. How much of this, to your mind, ma'am, is I guess what I'm saying is this: is there a resistance to do these reforms, or is this mostly finding the money so we can implement them?
Well, I mean, I think that the roadblocks we're hearing about all revolve around money, and in most cases, how do we pay to do this? I think that the facility operators, they go into this business with some sense of love and duty and caring for the folks that they're about to serve. But I think that, again, reimbursement rates being what they are, it's very hard to fully staff. And then, you have residents who need to be fed, who need to be entertained, who, have other concerns like you would in any household. And when you add to that the caregiver wages, it becomes very difficult for them to make ends meet, because this is, at the end of the day, a business. So we need to do what we can to improve reimbursement rates. Absolutely. And that's also what we need money to pay for inspectors, to pay for the additional supports that are needed to ensure these facilities work well. And one of the things that I think COVID certainly has been an additional stressor, but it's been the catalyst for ripping the lid off of so many issues that we're now looking at, not just in these facilities, but in our society overall. and you and Dana and Mr. Dunn have each mentioned it early on in this conversation. You know, something like 0.7%, less than 1% of our population lives in a long-term care facility, but the majority of deaths have come from these facilities. And that's not been inevitable. It's been because systemically, we do not value these lives. COVID has showed us which lives do not have as much value to our society. And individually, we're offended by that. But you can look at how the system works. Long-term care facilities, prisons, and then in our Native American population has not had the resources, the infrastructure, the caring systemically that they need. And it's shown because folks who are stretched, to the margins, when faced with these additional stressors, we can see that those systems have cracked.
I want to ask Representative Dunn. I actually want to go to some of the audience questions because there's several of them. I want to be able to get through, as many as we can. I want to ask Representative Dunn and perhaps Dana. When can there be minimum visitation requirements put in place for vaccinated residents in all congregate settings? Any ideas there?
Say that again. Redo your question again, please.
So, here's a question from Erica. She says that visitation, as we've heard from the panel, is still restricted even after adults living in congregate settings receive both doses of the vaccines. And we know how to visit safely, Erica's saying. When can there be minimum visitation requirements put in place for vaccinated residents in congregate settings?
Dana, I haven't read your proposal that you guys are putting out. Can you answer that?
I can answer that. So actually right now in Arizona, we updated the visitation guidelines in October. So each resident is supposed to be able to have two essential visitors that they can have visit them. That essential visitor does need to agree to be tested and wear a mask when they visit. And so if that is not happening, they're supposed to contact the Arizona Department of Health. And again, the visitation guidance is on the Arizona Department of Health's website, and they can just call the number and report that they're not being allowed to visit. And, but they do need to agree to be tested. So although other states, they're still shut down, in Arizona because of the task force, they're supposed to be able to visit. Now, some facilities are saying no, so just contact the Department of Health and let them know and let them negotiate for you.
Representative Dunn, here's a question from somebody who noted that, of course, when you mentioned DCS, we actually moved DCS out of that DES and created its own agency. I do want to ask you this question. It's quite an interesting question. What about the idea of moving APS into either the same agency, it's DCS, or maybe its own separate agency? Has that ever been talked about?
I think that part of that audit could actually, we could actually address that in the audit as far as, what is the next steps for making that agency better. And so I'd be open for that. I'm not an expert on where you move agencies and moving them around, but I think that's part of the purpose of that audit is what is the best thing for this agency, kind of like they did with the Child Protective Services, is get to, everything's on the table.
Representative Longden, go ahead, ma'am.
Yeah. So, this is one of the discussions that was certainly, one of the questions we were probing for early in our ad hoc committee. And the three of us and many others have been involved in those conversations. And I think that is an important piece of the APS audit, is getting that important data. And I think that there could be some efficiencies of scale, maybe in like the abuse hotline and these sorts of things. One of the challenges in combining these two together under one umbrella is the difference between children and adults. Now, we have a tendency, we all want to bubble wrap, our family member who's now living with this disability. And this disability could be part of aging. But remember, too, that we have a lot of people under the age of 65 living in these facilities because their disability means there's no place else that they can live safely. So these are adults that have agency, that can make their own decisions in many cases, who have certain rights that our children do not. So in terms of putting these two populations together under one agency, we're going to have some friction there that may not make that possible. But I think especially the abuse and neglect hotline, the place that you go to report, I think many of those questions, much of that intake process is similar, if not the same, and we could find some efficiencies there.
Here's a question from Jana, Jana, and I think Dana might be able to answer this one. What do you think about licensing credentials being done by organizations outside of ADHS, effectively devolving that authority to outside of the state agency?
I think it's something that should be looked at for sure. I think it's an interesting concept. And is that the appropriate place for it to be under the Department of Health Services? I'm not sure. But I think, just like Representative Dunn said, everything should be on the table and moving forward to look at what we can do to protect our most vulnerable adults.
Representative Dunn, here's a question for you from Rich. How will these three bills, the three bills that we talked about, change the outcomes, actually do change the outcomes, rather than just issuing fines against poorly performing facilities that are then closed or resold and sort of gutting out of the system?
Well, that's a good question, and that's kind of the root of what the pilot project is to not necessarily issue fines and put a report. It's to get that scorecard so that you can come through and say we're gonna raise the level of healthcare to a certain scorecard that we have, and try to come through and see what's falling through the cracks and what and figure out where they're falling. So the inspectors, the 44 FTEs, that's a matter of not having enough people to get around and to do those inspections. And when you know you're going to get inspected, whether it's you're a restaurant, you have a health inspection coming, your level of your cleanliness is always better. When you're having family come over to visit you for the weekend, you always have your house looking better. So it's that level of coming through and service that you're going to know that you're going to be able to be on point better, even though you know what you're supposed to be doing. Sometimes you just don't quite get it done as exactly like you should. So it's not necessarily to issue fines. That's not the goal. The goal is to raise the level of healthcare through that pilot project.
Dana, you mentioned earlier the kind of the distinction between long-term care, skilled nursing facility, and other facilities. Can you flesh those out a bit?
Absolutely. So a skilled nursing facility is under Medicare. And so the funding comes from Medicare and Medicaid. So that's important to note. Where assisted living facilities in your smaller group homes, they're simply licensed and they don't provide the same level of care. A lot of times assisted living facility is more of a continuing care retirement community where you may have an early onset diagnosis of Alzheimer's. So you move into a retirement community where it can, as your disease progresses, it will be able to meet your needs. And a lot of times that's just licensed. And so it's often private funding as well. So the government is not paying for your assisted living facility. You're paying for that yourself. And it's not cheap. And that's one thing I really want to commend the state of Arizona for developing our ALTEC program, Arizona Long-Term Care Services. We were one of the very first states in the entire country to make sure that if somebody qualified for a nursing home, that they're able to stay in their own home rather than go into a skilled nursing facilities. And we need to really look at that and dissect it and maybe, increase that program so we can keep people in their home and in their community rather than these congregate settings. And we also need to look at our skilled nursing facilities, which only often have 2 people in one room. We need to look to possibly only have 1 resident in a room with their own bathroom. So, this is a really bad pandemic, but it's probably not the last one in our lifetime, unfortunately. So we need to do everything to look at our long-term care programs in the state of Arizona.
I think you're exactly right, Dana. This is not going to be the last one. When I talked to SU President Michael Crow a couple of days ago, he said, we're not going back to normal. This is COVID-19. There's going to be a COVID-20, 21, 22, and so on and so forth. Representative Longden, here's a question for you, ma'am. What are plans to vaccinate people with disabilities who have transportation issues?
Well, that's a good question. I don't think we have a great plan at this point in time, and it's an issue that I've been asking about for a while. As you've said, folks who have transportation issues are having trouble getting to these mass vaccination sites. I think that for individuals who are part of the Access All Text program overall, have the opportunity to be visited in their homes. I'd like to see us offering those individuals their vaccinations in their home setting. Mass vaccinations may not be the best way to reach a population like people with mobility challenges, but we should be able to get to them individually. Hopefully at some point in time, my individual pharmacy, my individual doctor will be able to offer me my vaccination. But age is one of the factors that are making people vulnerable, but particular types of disabilities also make individuals vulnerable. For example, statistically, we've seen a lot of the younger folks who have died as a result of COVID have had certain types of disabilities, Down syndrome being one of them. So if you're a young person with Down syndrome, you're not eligible to be vaccinated at this point in time because you're not under 55 years old. So your whole family, if you're living at home, and most people with cognitive disabilities do live in their own home setting. So the entire household is being locked down, or you're adding additional pressures, additional risks, because individuals, may go out to work and could contract the virus and bring it home. So lots of work to be done and questions that we're all asking.
Representative Dunn, go ahead. I think you were about to say something, sir.
I was going to say, when I talked on that question you asked about the transportation issues, I know that in Yuma, I talked to our county health director last week. We we have a call every Friday, but they are starting to work with their Western Association Council of Governments that helps with the aging to get those, actually the home health people that are home. They're actually working to do vaccines starting now. I'm assuming they're working statewide with all those organizations to start that, just now starting it. So they had to do they're trying to focus on the home facilities first. Now they're working out of that starting this last week. So there is, I believe, a little bit of a plan, but it's not been really presented out to the public yet.
And we are out of time. I want to give Dana, if you want to add something real quick, ma'am, about this particular subject, and maybe some note of optimism that we can overcome these things, that these are problems that we can go through, navigate through, and a lot of times we're able to in fact fix them.
Well, since the beginning, I have been watching, the death toll in our long-term care facilities. And I'm hopeful now that all of our residents in skilled nursing facilities have had the opportunity to be vaccinated, as well as the staff, and our assisted living facility as well. And this is the population has been hardest hit. So the fact that they are now vaccinated or close to being fully vaccinated gives me hope. And I really want to thank the governor for making them a priority. And I have, spoke out when I needed to, and I have also, gave congratulations on doing a good job when needed to as well. So that gives me optimism. And if people are planning to care for a loved one, AARP has a guide called Prepare to Care, and just Google AARP Prepare to Care, and you can download the guide, and it walks families through what they need to do to plan to prepare to care for their loved ones. Thank you for having it.
Thank you, Dana, Representative Longden, Representative Dunn. Thank you for your time. To our viewers and to our listeners, thank you for spending the hour with us. I hope you learned something, as did I. And please enjoy the rest of your day, and I'll see you soon.
Thanks for inviting us.
Thanks,
Bye.
everybody. Have a good day.
Bye for now.